Welcome to Your Health. We are so excited to have coming to Montgomery the UAB Baptist Multispecialty Clinic, which is located right where the Baptist South is and the UAB Regional Medical School. And we have specialists that we have had such a tremendous need for. We are blessed to have with us today one of those specialists. And Dr. Aggarwal, we are delighted to have you. And you are specializing in urology.
Right.
But I would like to ask you first,
Yes.
What made you decide to come to this specialty clinic here in Montgomery?
So when I was interviewing for the jobs after my training, I met Dr. Asimos, who is chairman of urology in UAB. He's a very well-known physician and urologist nationwide, and he introduced me to this opportunity, and he said, I'll be part of UAB academic faculty, and also this area needs a urologist and especially urogynecologist, which is my subspecialty, and there is a huge need. And then when I came here for interview, they showed me the plan, and finally it has come to live, and it's amazing to see the new facility. We have current edge technology with state-of-the-art facility now. So
Well, and I'm sure it's a tremendous help. You still remain a professor or on the faculty at UAB,
Yes.
and yet you will practice your urology specialist here
in Montgomery.
in
absolutely.
Montgomery, which is just incredible
Right.
for us. And I noticed that when we were looking at this, Jack and I were fascinated that you're the only person in this city that specializes in one area of urology. Would you tell us a little bit about
Right,
that?
absolutely. So I have 2 additional years of fellowship training in urogynecology or female urology, and nowadays it's called female pelvic medicine and reconstructive surgery. So I'm sure you've heard or seen commercials from lawyers about
that mesh.
vaginal mesh.
Right.
Yes, exactly. And this is a huge problem. FDA banned and gave a big warning in 2011 about using these mesh. What has happened in the last 10 years is, these mesh companies came with vaginal mesh kits and all those things, and they trained physicians on cadavers, dead patients, over a weekend. And you can imagine how these people have started putting these meshes without proper training. And forget about how you take them out now. In best hands, there is 10 to 15% chance of major complications in patients. And imagine these meshes are being put by everybody who doesn't even know how to put those in, and they can't even take it out now. So, come to the chase, I am trained to take these patients, to help these patients by removing these meshes, by doing surgeries or procedures using patients' own tissues. So I don't use mesh, and preferably I can in some cases if it's needed, but more importantly is if there is a problem, I can take care of them. Right.
So you're trained to undo the damage that has already been done, in
Right.
essence.
Yes.
Absolutely.
And that is amazing. Our audience generally ranges from 50 on up.
Absolutely.
And so we hear a tremendous amount about the problems with prostate cancer,
Absolutely.
which then hand in hand you have urological problems as well, and you work in that area as well.
Absolutely. Prostate cancer is one of the most common cancer in men in the US, and also in African Americans, 1 in 3 people will be affected with prostate cancer. So it's a very high prevalence in African Americans especially. So not all prostate cancers are deadly. First of all, having a prostate cancer diagnosed doesn't necessarily mean it's a bad disease. A lot of prostate cancers can be just managed by keeping an eye on them, and that's the reason you should visit a urologist, get checkups, if need a biopsy, get a biopsy, and then decide the treatment plan which fits your scenario.
In normally your general practice, doctor, if you're going for a yearly exam, will sense something's wrong, and then they will refer to you.
There is a little controversy these days because one of the National Society of the General Practitioners said to not check the blood test or PSA any man, which is very, very wrong, to be honest.
Right.
Our national society, international societies have come up with guidelines. We don't recommend checking on anybody. We do have some, we don't recommend checking on everybody, I mean to say, but we do have guidelines, specific guidelines to send PSA on patients who are at high risk for sure, and also other men every 2 years. And there should be a discussion. First of all, not elevated PSA can be from so many reasons. It doesn't necessarily mean cancer. Only 20% of the patients with elevated PSA will have cancer on biopsy.
What is the right age to begin checking?
So, as per guidelines, it says patients after 55 years of age.
Okay.
It used to be 50, now it's changed to 55. And from our national and international guidelines.
Now, do we need a referral to come and see you, or can we just simply get in touch with you and make an appointment?
No, you can simply get in touch with me and make an appointment.
Okay.
And if you come with a referral, that's welcome too.
Good.
All right.
Well, we're so happy
Thank
to have you
you.
here.
I'm
Very
glad.
much needed.
What a
Thank you so
joy,
much.
and we
Thanks
appreciate
for choosing
it.
Montgomery.
And stay with us, and we'll be right back.